Hey, welcome back. Thanks for joining me this evening. Dr. Ann here, and I appreciate you coming back for some more discussion, especially tonight for something that's incredibly important. So this is our Vagina Happy Hour, and really the discussion for tonight has been titled Saving Lives One Vagina at a Time. So I appreciate you having a little bit of time, women, and hopefully couples even, for some really important and passionate discussion that's worthwhile for a little bit of our time. And I do have some note cards tonight because I have a lot of information to share with you, so no judgment, and you'll see me referencing those a little bit because I really hate that feeling when you don't get to cover something. So I did want to start off saying, of course, whatever we discuss tonight, it's not a substitute for having a true face-to-face discussion with whomever your clinical provider is, of course. This is really some fun but relatable and well-founded discussion that maybe gives you some guidance or food for thought. All right, and also I really wanted to start off by saying we're not the same. We share a lot of similar qualities everywhere in our body and our minds and our emotions, and the pelvic area is no exception. So a lot of similarities foundationally, but also we are very different. We're unique and we're individuals. So that's why we should be very careful of following a cookie cutter plan, which a lot of clinicians do with you as a patient, unfortunately, as well. And you want to be your own advocate and remember that you're an individual, and so your needs and outcomes are going to be very individualized. Talking about this tonight really is because I really prefer to reach out to a demographic that understands that part of our overall best wellness plan has to do with our intimate wellness and being very optimal in that area. And making sure we are best in our vaginal and pelvic tissue is no exception. And that's what we're talking about tonight. So really I wanted to address in our intimate health and wellness 5 main areas that I go over with my patients very frequently that I think are worthwhile for you to consider for yourself to discuss. And the first one really is just foundational, which is know your anatomy. And that really is a basic statement, but it makes sense because it's also relevant to not just know our anatomy, be comfortable with it at any age, to be honest with you, but understanding too that it changes at different seasons in our life, right? And you know, in our house, whether my kids liked it or not, even from an early age, I really use the correct terminology with our kids, you know, because I think it actually helps to promote an issue of more respect, both self-respect and respect for others as they're aging, where we're not minimizing or learning only the silly or vulgar terms for our anatomy, but the proper terms with respect to penis and vagina and breast and clitoris and nipple and areola, etc. It's really important to get your children at a reasonable but early enough age so that they understand the true understanding and respect. And for yourself, really important to understand our anatomy, because then we know what's normal, what's not normal, what needs attention, or what could we improve upon, right? And, you know, so learning the anatomy both externally and internally. There's a lot of soft tissues, and then there's bony pelvic support. And with respect to the anatomy externally, you know, understanding that the outer area, which we call the vulva, is basically encompassing the labia majora, and the minora, or the outer and inner lips, and then the clitoris or clitoral hood tissue, and then the introitus, which is our vaginal opening, which is where we used to have our hymen, and then we lose that, of course, and it becomes a hymenal remnant at the introitus, or the opening. And also, of course, the urethral opening is coming there, or the tube that drains the bladder. And then the vaginal opening, and then just beneath that is our perineum, which is a small tissue which varies in length in between each of us and individuals, from the vaginal opening to the anus, or the anal opening. And then the area that's just above the whole vulvar area is basically our mons, as we call it, which is an area there, and the majora, which is going to have our hair growth, well, which used to be, but now, of course, we laser everything or remove everything there, but that would be what that area is. So that's really the basic anatomy. And in the vaginal canal, of course, it's like a tunnel. At the back of the vagina is going to be the cervix, which will then go internally to the uterus and the rest of our pelvic organs. And then anteriorly, or on the front area of the vagina, is going to share a wall of support between the vagina and the bladder. And why a lot of the treatments that we're going to talk about not only benefit the vagina, but also the urethra, or the tube draining your bladder, and the bladder. And then posteriorly, or in the back area of the tunnel of the vagina, is where we share a wall between the vagina and the rectum. And why treatments also benefit that tissue and that area that we're going to talk about. So it's really an all-encompassing area. And then, of course, other than all the ligaments and the soft tissue supports of the pelvic tissue, is all encased in the bony pelvis, or your pelvic bones. And we have bones that go around from the anterior, or the front of the pelvis, around to the posterior and the back. And so all of that is this beautifully encompassing and really central, important structure for the body, both above and beyond that. So it's really kind of like an essential part of life as we know it, and an incredible area that's very worthy to understand or ask questions if you don't. And don't Dr. Google everything, because not all of what you hear is going to be accurate. So ask questions to someone who's an educated and passionate provider. But it's very important, because when we learn our anatomy, we know, again, we fully understand what we can maybe tweak upon or improve upon, and also what we should accept. Because there's a lot of things about our anatomy, since we're different, that we just need to simply accept, especially at certain seasons or different seasons in life. And that's important too. All right, so that's number one, which is know your anatomy. And number two, we move on to things that help but do not treat. And that's really important. So this is just a subset of an area that has to do with things that are kind of helping on the surface, but not necessarily treating or curing things that are underlying issues, right? Because a lot of things we experience are symptoms of a disease or symptoms of an underlying imbalance or issue. And it doesn't mean that's not okay, but we just want to have an accurate understanding that they're not fixing or treating, but just helping. So things like that would be things like even doing our Kegel exercises that we all might be familiar with. I've done it for so many years teaching patients, so I'm kind of doing them all the time. But we were kind of strengthening. Sometimes we describe that as helping the same muscle that we're kind of using when we're tightening it to stop the flow of urine. Similarly, and it's good to practice, whether it's with yourself or with your partner for fun, or with your clinical provider, to make sure you're doing it properly. But it does help some to improve. It might not make it from day to night as far as improvement with respect to the tone or elasticity of our vaginal tissue, but it does make some difference. But you just want to make sure you're doing it properly with respect to how long you're holding and how often you're doing it, and that you're using the right muscles. So other than that, also is even the discussion of lubricants. And I typically discuss with patients more plant-based lubricants, so maybe organic coconut oil, not to mix up with what you're using in the kitchen per se. Grapeseed oil is really super nice, tissue-friendly oil. But those would be some examples that I might recommend, but they have kind of that really yummy, gooey, healthy type of consistency, very safe to use. And remember, lubricants are different to use if you're during a fertile time in life, or where you might be conceiving, versus when you're not conceiving, which is my neck of the woods. So you always want to discuss those things. But of course, lubricants are very good to use with foreplay especially. And yes, ma'am, let's remember, foreplay is a thing. We don't want to give up on that. But good to use, especially with areas of dryness. And we're going to talk about that further in the next section. But otherwise, just a nice thing to integrate with foreplay and with sexual intimacy and relations. There's other things in this category that are, again, helping but not curing per se, that can be made up even at our beautiful, incredibly educated friends at the compounding pharmacists, of certain creams that might help to stimulate tissue, kind of like female Viagra, type of things that can help to stimulate the clitoral area as far as external orgasm, because let's also have that discussion, which is we can have satisfaction from internal orgasm, and then there's external orgasm, and that changes at different seasons in life as well. And so that's important to discuss with your partner, or really just to know about yourself. But some of these external creams help to facilitate stimulation, so they're kind of fun to play with. And also the arousal tissues that we use with some of these things need a little bit of help, and so there's nothing wrong with that, and that's fun to play with. Also, there's even some supplements that we might take over the counter that help to make sure we have a proper pH balance, maybe help to avoid chronic UTIs or cystitis or bladder irritation or infections. Not to take the place of an antibiotic per se, but sometimes to help in a preventative way if we know we have recurrent issues with pH imbalance, vaginal irritations, yeast infections, UTIs, etc. So certain supplements we can take over the counter to help in a holistic preventative way, which is fine. And also even a lot of creams and oils that are coming out with CBD applications. So all types of things that are helping really to help our tissues to be healthy, balanced, retain moisture, and to be intimacy ready. And that's a very slippery slope to stay on top of, no pun intended. So those are just a few things about things that help but don't necessarily cure or treat, but they have their place. So number 3 is get the mind-pelvis connection. And this area is so important. It really could be a discussion by itself on a face-to-face or intimate level. But let's be honest, as women, we're really kind of like a 70-30 percentage with respect to the connection between our minds and our pelvis. And I think that's pretty true. So men, I would certainly say, are almost, depending on their season in life, but almost 100% below the waist with respect to optimal intimacy and physical intimacy and sexual relations and libido and whatnot. Anything could be happening and can be ready to go. For us, we have a little bit of a different thing going on, and that's okay. But let's just bring that to the table for discussion and then just work with it. And so, the mental versus physical with respect to consistently healthy sex and orgasm is something that's a real thing to address about ourselves. And, we might even say that's one of our main, if not our only, inferior qualities with respect to our male counterparts is this, because it is super cool that they are able to function at almost all the time. We have a different situation, and that's okay. But again, we just address it. And why? I think 2 kind of broad reasons. So one is that we have distracting thoughts, and 2 is that things that have to do with like self-judgment. And that might be things that are going on with how we're feeling about ourselves or in our relationship in the present, or things that we bring from the past. So I think really those 2 general areas, without going into detail during the scope of something like this, is why we have a distraction or a disconnect between our mind-pelvis connection. And it's really important to be able to address and have a discussion with yourself, your provider, and your partner about. Because when we have those distractions or that self-judgment, it kind of basically brings us into kind of like a vagina shutdown phase, and it's certainly not good in what otherwise would be a very healthy relationship, because that's important too on both ends. But if otherwise it's a healthy relationship where both people are meeting in a like-minded way for our physical intimacy, and there's a shutdown on your part, then that's something that you have to learn to become comfortable with exploring with respect to reconnecting the mind-pelvis connection. And it's important. So how do we work with that? Other than addressing it with a clinical provider and with ourselves and with our partner, is learning even about things like breathing exercises, meditation, even things like Tantra or some Eastern beliefs that are very incredible within reason and within your comfort zone to integrate with respect to relaxing and restoring that mind-pelvis connection. And really that's about bringing into focus and being into the present moment. Not being out here or out there or at yesterday or where the kids are or what's bothering us or whatnot, but being present in the moment so that we're honoring ourselves and getting the most out of the moment. It's not just for the other person that's there, it's for us also. So remember that. And other things also has to do just with communication. So making sure you're expressing your wants, your concerns, your needs, your desires. It's so incredible to be talking. Are we talking with our partners? And it's something I think that is worthwhile to take the time to do with each other, because a lot of times we might think we're okay or we got it going on, but either we don't at all and we're completely missing out, or maybe we do and we think we have it going on pretty well as partners. But hey, maybe we can even take it up a notch with different levels of communication and exploring our edge or whatnot. So it's an incredible area to visit completely, both with yourself and some practices, again, with the breathing or meditation or and whatnot, and communication, also with a clinical provider or a counselor, and just with your partner yourselves, and practice it together. And who knows, it can get better and more rewarding, more satisfying for most of us, certainly, if we dig deep comfortably, and otherwise even just take it up a notch. Let's have fun with it, right? So again, getting the mind-pelvis connection, very important for optimal intimacy and vaginal and pelvic health. Number 4 is hormone restorative therapy. So this area I kind of like to describe an analogy with respect to a dried up or dead flower, because that's what we are, ladies, right? We're a beautiful lotus evolving. And you know, if you think of the hormone restorative therapy, it's kind of like the watering, which is helping to totally coat and awaken and restore a flower back to its optimal vitality. And it's really important, and it's really what it does. And that might not be the right thing for you, but for most of us it is. And primarily, I want to say, don't assume you're not a candidate. So make sure, please, that you have the right information, that you're with an educated, passionate clinical provider, such as myself and many of us out there, that are truly your advocate, because you don't want to assume things that are not necessarily true or based only on assumptions or theories or causation, but not really true fact. So make sure again that you're discussing or having this discussion with the right provider that's your advocate to see. Because otherwise you may be missing out. And you want to get the education and understand there's a difference between local and systemic hormone therapy. And there's also a difference between synthetic hormone therapy and bioidentical hormone therapy. And either one might be right for you and what you decide for yourself. For our practice, we typically only prioritize in bioidentical hormone restoration therapy. Again, it's very customized and very individualized, a lot of crossover and similarities as well, but really that comes to place with an individual discussion and consultation, and that we do in the office on a case-by-case basis. But it's very important to understand. So systemic hormone therapy has to do with taking things through the skin, or orally, or sublingually, or injections, or hormone pellets, and there's different routes, but those are all going for a systemic support. So that's more for overall symptoms of menopause. And remember, when we are hormonally imbalanced or deficient, typically that can happen chronologically, of course, at menopause, which in our country is roughly around age 52, but also prematurely or surgically. And surgical menopause means you've had a total hysterectomy. So the uterus, cervix, tubes, and ovaries were all removed. So that can prematurely set you into a state of total hormone imbalance or deficiency. And again, those procedures are absolutely indicated sometimes, but then what? And so you want to make sure you're with the right passionate provider that's going to help you with those next steps and that next phase in your life. Because it certainly does not mean, oh my gosh, it's the end because I had a hysterectomy. Absolutely not. We can do types of restorative therapy, working and integrating with all the other things we just talked about, to bring things back to vitality and to a restorative place so that you can still feel like an incredibly empowered woman, and you can still feel that you're able to have an intimate relationship with your partner, so that you don't feel that you've been cheated in that area. because again, like we started off saying, our intimate wellness is part of our overall aging well and our overall health plan for ourselves. So really important to understand the difference between systemic therapy, which many of us benefit with respect to hot flashes, trouble sleeping, mood swings, problems with libido, bone health, all kinds of other cellular things that are improved upon with systemic versus local. And local hormone support is really just sources of vaginal creams and modalities that are totally, again, just helping at the receptors in the vaginal tissue that we talked about, supporting the bladder health, the urethra, the rectovaginal tissue, and all of those supportive structures there locally. So many patients are easily candidates, at least for local therapy, even if they don't opt for full-blown systemic therapy. So again, make sure you get the best information to see from, again, a clinical provider that is well-read, realistic, and passionate for you, and remembering that they're an advocate for your health and wellness, and not not dumbing down or belittling our intimacy. So it's not just the Viagra generation. Awesome. I'm a huge fan of those types of things as well, but that's not it. It's also our end, okay? And we want to remember that we're honoring ourselves with respect to our optimal health. And bioidentical hormones or hormone restorative therapy can be an incredible part to kind of bring back the vitality of that beautiful flower. All right, last part is number 5, which is lasers and rejuvenation procedures. So wow, who knew we would ever be talking about lasering our vaginas? But yep, here we are. And when we say the phrase lasers, so certainly we can say we've come a long way, baby, and we have. We're really talking about heated energy delivery devices, and there's several different ones on the market. And basically, for those of us in the gynecology world and even the medical and aesthetic laser industry, this has been a game changer. I have to tell you, I feel so blessed and fortunate that I can offer these procedures to our patients here in our practice because hormones, of course, can do incredible things to the vaginal and bladder and pelvic tissue support as we're aging and in a restorative way. But when we integrate that with the laser or heated energy devices and that technology, it's like, boom. I mean, it's just like takes it up a notch. Again, total game changer. And we're really blessed that we can offer that to patients that are candidates or that are interested. And you mostly want to make sure you're with a provider that is trained and passionate about these services because like everything that comes onto the market, especially that's kind of new or cutting edge, sometimes different people come to the playing field that don't really have your best interests at heart and aren't really just really participating fully, embracing the technology, the education, the passion, the safety with it. So you really want to make sure you take your time in choosing someone who's on board with this plan for you. But that being said, there's different types. At our practice, we offer a couple of them. One is the Thermiva, and the other one, which is kind of our mainstay really right now, is the Core Intima platform. And really all of them, but definitely the ones that we have been able to provide for patients the past several years, because we really were kind of on the forefront of things. Again, very blessed to say so. Really are all basically combining types of technology that are delivering heated energy and pulses, very calculated pulses that are very directed at all of our vaginal tissues and in a very selective way that are delivering these pulses in a very effective but safe, calculated manner. And what they are doing is basically completely restoring the tissue. And of course, outcomes vary and things vary depending on how your tissue responds, the age you're at, etc. There's a lot of variables, of course, but the outcome by far is incredibly rejuvenating with respect to the ability to bring back elasticity in the vagina and all of its support structures, and help with things that are recruiting collagen and elastin fibers, which we just can't simply do anymore at a certain age, similar to what we do in other areas of the body with the laser technology. And so it's just beautiful devices, and basically the indications are broad, and whether you're having them now, let's face it, you're going to have them at some point. And really the indications are improving upon our bladder health, so recurrent UTIs or bladder infections, different types of mixed urinary incontinence or bladder leakage, so without having to do surgery, which is incredible. Very reproducible changes, helping for maintaining proper vaginal pH, helping with proper moisture and lubrication, which is huge. So maybe you didn't opt for hormones for our lubrication, but maybe you want to use the lasers, or both, which is my personal favorite. But otherwise, it's an option if you don't opt for hormones to incredibly restore the vaginal lubrication and overall health, the supportive structure, bring back the resiliency and the responsiveness in the tissue with respect to our sexual intimacy and satisfaction. Really just completely, that's why we kind of lump it all into a sum of rejuvenation, using that term, because there's so many areas that it helps us at whatever age, especially once we've already been to childbearing, especially once we get to hormone imbalance or deficiency or menopause or after hysterectomy, and really a preventative. So it's preventative aging and it's treatment. And so it's treating and preventing. And honestly, with respect to, again, especially combining with hormone restoration, but even on its own, it's been such a beautiful thing to offer to women that are completely empowered on treating themselves, restoring themselves with respect to optimal intimacy, and preventing. It really, I tell my patients that we basically, when we do these treatments, we're basically stopping the clock on our pelvic tissue from aging, and we really have not been able to say that before. So it's pretty awesome. And that's it. So that's our 1 through 5 with respect to our saving lives, one vagina at a time. And I hope it was enough information for you to at least start to explore it, and not to get complacent, because it's an area that we can get complacent with respect to our intimate health and wellness. But when we embrace it, explore the edge a little, empower ourselves, it's really can just take aging well to a whole different level with ourselves as individuals and in our relationships. And I just really quickly want to make a commentary with respect to 2 things on why we do it. And one is that for men might say, hey, you don't need it, you're fine the way you are or whatnot. We don't necessarily want to hear that, because we're mainly doing this for you and for our intimacy together, but it's for ourselves. And so if this is something that your partner wants to do with respect to any of these treatments, then be empowering for that. And because it's really important to feel supported in things that have to do with us being able to give back more from ourselves. And for ladies, I don't like to really contribute to the fact of, well, it's not necessary, we don't have sexual intimacy anyway, or he can't really provide for me in that way anyway. Hey, this is for ourselves. Again, there's health reasons why we restore and replenish and rejuvenate our tissues and maintain our health in our tissues. And it also has to do with us and for our relationships. And so it's something that we're doing for ourselves. And I want us to remember that, And I think it's really important to remember self-love and healthy selfishness with respect to having this type of discussion. And, summing all that up is just, this is such an incredible topic to bring up, to discuss for yourself and your own awareness, but in your relationship with your clinical provider that's hopefully passionate and on board this with you, so that you're not missing out as we're aging, because that's what it's all about, right? Doing things that keep us all in together so that we're living, aging, and feeling better. So thanks so much for joining on this kind of lengthy chat to bring this very important area up for discussion. And I will see you soon, and thanks for choosing to be all in with me. Bye-bye.